lesson, if you let me. I recorded. My dears, you know that in our previous lesson we talked about geriatric dosage forms. Yes? Who can remind me what means geriatry, what means gerontology, what means who is patients, geriatric patients? Who can say me?
Is it for the old people, for the adult?
From which year old?
Geriatric, I think. Yes, geriatric is for the adult people.
I know that adult. From which years old we say that this is geriatric patients?
From 15 until up?
From which?
15? I don't think so. Maybe.
Mustafa. There are three, by classification of health organization, we say that there are three groups: young elder, old, and long livers.
Okay.
From 60 years old. I want to remind you what we learned at our previous lesson, the classification. And who can say what means geriatry and gerontology? Please look to your desktop. I show you our previous lesson. Gerontology. Who can read? What means gerontology? Ziyaddin?
For old people.
Gerontology is the science of old age. Please read this moment. Is the science of old age. Gerontology is divided into fundamental gerontology and social gerontology and geriatrics. Yes? Do everyone see my desktop? My dears. Mustafa Alani, Mustafa Al-Rikadi.
Yes, teacher.
Do you see my desktop?
Yes.
Tola?
Yes, teacher.
Mushtaba? I want to hear you. Open your phones, please.
Teacher, we are listening.
Murtaza? Please, my dears, listen our lessons, and I want to hear you too, please. So, Mustafa, old patients, I want to remind you that the age from 60 to 74 years is considered as old. From 75 older and old age, people age from 90 years are long livers. But foreign literature classified so young elderly from 65 to 74 years old from 75 to 84 years old, and very old from 85 years old and older. Can you write to Hiba, Najla, and other students to join us, please? You want this time, you said that 11 is early morning, and we start in this time, please. Everyone said to join us. In our previous lesson, we talk about theoretical part of geriatric dosage forms, but today I want to discuss with you the making process and preparation of prescriptions for elder patients, for older patients. Hiba joining. Write to Najla too, please. So, geriatric dosage forms. We know that basic principles of drug therapy in elderly patients, which the appointment of a minimum number of drugs. We talk about this in our previous lesson. no more than 2 or 3 names. An additional drug is prescribed if it facilitates those disorders that worsen to the quality of life. Reduction of doses of most drugs by 1.5, 3 times compared with average doses. Optimal frequency of taking medications 1 or 2, not more times a day. It is preferable to prescribe tablet forms. Liquid forms are poorly dosed due to poor memory and vision of patients. Correction of long-term drug therapy at least 2 or 3 times a year. It is advisable to prescribe multi-directional drugs for elder patients. I want to remind the classification. I repeat. Persons aged 65 years old and older constitute 13% of the population and purchase that 33% of all prescription medications. By 2040, 25% of the population will purchase 50% of
Müəllimə, bizdə şək zəifdir.
Bizdə, məndə, maybe. Don't you see my desktop? Everyone hear me?
Yeah, teacher, we hear.
Okay. We will purchase 50% of all prescriptions. Hiba. Hiba,
Yes, teacher.
how are you, Hiba?
Fine, and you?
Where Nejla?
I don't know.
Write her, please.
Okay.
Müəllimə, səs gəlir, gəlmir. Belə ses zəifdir tam.
Murtaza, everyone
Bəli,
hear
bəli.
me. Only you are have problems. Ancak sen işitmirsen Murtaza. İnterneti yokla. Please play in piano. Please playing in piano, my dears. What happened? What happened? Okay.
Teacher, I think
Nereden yox müəllimə?
because the internet is very weak with Murtaza.
Səs.
I have not good internet. My internet is bad.
No, teacher, your internet is good.
Murtaza internet.
Ah, Murtaza internet. And he continued to play in piano, or I don't know.
Müəllimə, vallahi elə 3 səhv girmişəm Zoom proqramına, çıxmışam. 3 səhv, 4 səhv. Bundan telefon uzatdır, söylə bir də qayıdır.
Murtaza, icazə verirsense dersimizi aparar. Kulak as bize. Olar? Okay. We continue. Challenges in geriatric pharmacotherapy. New drugs available each year. FDA, Food Drug Administration approved, and off-label indications are expanding. Changing managed care formularies. Advanced understanding of drug-drug interactions. Increasing popularity of nutraceuticals. Multiple comorbid states. Polypharmacy. We talked about polypharmacy in our previous lesson. Medication compliance, effects of aging, physiology and drug therapy, and medication cost. Now I start to give you prescriptions which I think that inshallah we will prepare in our laboratory. We start from soft dosage forms. Our first prescription, recipe, olei mente pipedite 36 gram, camphor 10 gram, and olei cariophile 1 gram. This is for rheumatic or arthritic pains, for joint pain. We name it joint pain ointment. How we can write a worker recipe for this prescription, my dears? Who can say me? How we can write and how we must write worker recipe to this prescription? What means worker recipe? Passport. Why we write passport? Why we write worker recipe for prescriptions? My dears, Tola,
Yes, teacher.
why we write worker recipe, Tola? What means worker recipe in pharmacy?
I forget it.
We write in worker recipe amounts of ingredients which we take for our prescription. For easy working, we calculate the needed dosages of ingredients, all substances, and write our worker recipe. In this recipe, in the first recipe, how many we must take? Olei mentopipirite, camphor, and olei cariophile. Very easy prescription for preparing, because ointment and very easy ointment. Who can say me how we can prepare this ointment? Eva, please help me. We need which substances? Does we need any excipient substance or helper substance for preparation of this prescription? No. Please help me, anyone. This is very easy ointment. We take only those substances which are written in this ointment. Olei mentopipirite, camphor, and olei cariophile. And in this second recipe, we take same mentholum and unguentum camphoratum. Only these amounts which written in our prescription without any helper substances. Our second prescription, OXIDE salicylici and vaseline. This is callus ointment. I show here callus ointment. Easy for preparing. Same, we take only acidum salicylicum and vaselinum, and we dissolve this acidum salicylicum in our vaselinum, and after packaging and labeling. This is this ointment, salicylic ointment. Our third prescription, wrinkle ointment for wrinkles in elder patients, very easy for preparation prescription. Lanolinum, 100 gram, oleum cacao, 10 gram, and oleum olivari, 15 gram. The base for this prescription is lanolinum, because in the big amount we take lanolinum, 100 gram. How we prepare it? We dissolve olei cacao in the water bath in lanolinum, and at last we add oleum olivarum. After package and of course labeling. In a label, what we write in label, my dears? For ointment, what we must write? I am one without no one in this lesson. I think that I read it. I learn myself.
Teacher.
Yes, Hiba. Please help me. In the label of ointment, what we write?
For out using or something.
For external using, yes. For external using, after?
Time.
Who prepared? Who
Yes,
checked?
time.
Yes. Preparation time. Who prepared, who checked, and who released from pharmacy, yes?
Yes, dear.
Our fourth prescription, pastes. Which paste do you know? Which paste we prepared in our laboratory, in our classes? Who remember? Who can remind me?
Teacher, we don't do it.
Zinc oxide?
We don't do it. In my group.
Ali? Tola? Tola?
Yes, teacher.
Ah, okay. At that time, I want, please say me, which paste we prepared in our laboratory?
I say, teacher, we don't do it in our group.
Not Tola. I say about I3. Mustafa, Hiba. If you remember, we prepared zinc oxide paste, if you remember. I remind you paste recipes, prescriptions, gelatine, 15 gram aqua purificate, 500 gram zinc oxide, 250 gram, and glycerine, 250 gram. Who can say me how we can prepare this paste? And for what gelatinum here? Gelatinum is active substances or other, or excipient. Gelatinum here is emulsifier. Yes, my dears. 15 gram gelatinum we take for helper, as helper substance. And solvent for this base, for this paste is aqua purificate, because big amount, 500 gram. There are only 250 grams zinc oxide and 250 gram glycerin. This paste is used to treat trophic ulcers in the elderly, since trophic disorders of the lower extremities are not uncommon in elderly patients with peripheral vascular diseases, venous inflammation, and diabetes mellitus. Our next prescription for elder patients, salicylic zinc paste, commonly using in dermatological practice, used externally as an antiseptic, disinfectant, astringent, and drying agent for skin disease, such as psoriasis, dermatosis, and others. The paste is applied in a thin layer to the damaged area of the skin 1 or 2 times a day. It is stored in a dark place. This is the zinc oxide, salicylic acid 2%. Including of our prescription, acidum salicylicum 2 gram, zinc oxidum 25 gram, amylum 25 gram, and vaselinum 48 gram. Who can say me how can I prepare this prescription? Who can say me? Ziyaddin? Ziyaddin?
Yes, teacher.
Can you say me how we can prepare this prescription? Khalid? Muhammad Mohsin? Nobody here. Mushtaba?
Yes, we hear you, teacher.
How can I prepare this prescription? Patient give me this recipe and I must prepare it in my pharmacy. Please help me. Which ingredients I must take and step by step preparing of this recipe. Help me, please.
First, we take acid and salicylic.
I think Vaseline, teacher.
First, we take the base, Hiba. The base
Yes.
of this
Vaseline.
ointment, Vaseline. Of course, Vaseline. After? First step, we take our Vaseline as base of this ointment. Yes, my dears. Paste.
Yes.
After, we weight our other ingredients. Which ingredients? From big to small. From big to small. Zinc oxide, active
And
substance.
amylum.
Amylum is not active substance. Amylum is starch, is a helper substance. At first we take our active substances, zinc
Zinc
oxide,
oxide.
and salicylic acid.
Acid.
And we carefully dissolve it in our vaseline as base. Yes? And after for helper to form our ointment, our paste, we add amylum, starch, 25 grams. And after we carefully mix them until forming paste form, homogeneous paste form. After package and label it. And what we must write in our label? Muhammad Ahmed. What we must write in our label? Just now I explained it. Mustafa Al-Rikabi. Hiba, please remind us what we write in our label.
For external use and time and name of pharmacy.
And signature. What we must write in signature? Apply to the damaged area of skin 1-2 times a day. But for elder patients, we always write the time, such as 1 o'clock, 3 o'clock, because they are forget commonly. Okay? Our next prescription, Lasar pasta, paste of Lasar. The containing of this paste is acidum salicylicum 1 gram, zinc oxide 12.5 gram, amylum 12.5 gram, and vaseline at 50 gram. This is a ready paste of Lasar, but in our pharmacies we prepare this paste, and commonly for elder patients. For such diseases, for treatment of pressure sores and superficial wounds, method of application, applying a thin layer to pressure sores and wound aged 1-2 times a day. And storage condition, dark place. Please now, for this prescription, help me. How can I prepare this prescription? Same as previous. Mustafa, please, Mustafa Al-Rikabi and Mustafa Al-Ani, please help me. How can I prepare this prescription?
It is the same.
Please repeat step by step.
At first, we take vaseline, then zinc oxide, then we add acid salicylic, and finally we add amyl.
Okay, it's good. Same, but containing only different because amounts is different. Zinc paste, which commonly used in geriatric practice, include zinc oxide 25 gram, amylum 25 gram, and vaseline add 50 gram. Difference in compare with previous prescriptions, that is salicylic acid is absent. For this prescription, we take vaseline, zinc oxide, carefully dissolve in this vaseline, and after we add starch, mixing carefully, and after until forming a paste homogeneous consistence, and after we package and label. Our next prescription. Our next prescription, creams forms. Who can say me how we classify creams? Which forms cream form? Solid or soft form?
Semi-solid.
Semi-solid. Cream is semi-solid?
No, teacher. Liquid. والله I mix it.
Soft form, my dears. How we classify dosage forms? Solid, liquid, and soft forms. Yes, my dears, and semi-solid forms. Which forms are solid forms? Who can say me?
Powder, capsule, tablet, powder.
Of course. And which is liquid forms? Which forms we name that they are liquid forms? Please.
Syrup.
Syrup.
Syrup.
After?
Emulsion.
Emulsions. After?
Yes.
Suspension.
Suspensions. After?
Emulsion.
Yes. After? In cosmetic practice, which liquid form we use? For clean face or skin, Hiba.
Cleansing.
Lotions,
Lotion.
milk, lotion, and others. And we use as liquid forms in elder practice, in geriatric practice, mixtures. What can you say about mixtures? What means mixtures?
More than two substance.
Aferin. More than two solid
Mixed
substances.
together.
Solid, there may be solid substances dissolved in solvent or liquid substances in liquid solvent. Yes, my dear. Now I show you in this slide two forms of prescriptions, two prescriptions. In first prescription there are lanolin 50 gram, oleohyliantin 50 gram, retinol acetate 10 gram, and active purificate. What means retinolum acetatum? My dears, what is the retinolum acetatum? Vitamin, which vitamin?
Vitamin A.
Thank you, Hiba. And our second prescription, which contain solutionis iodis spirituosis, 5%, 20 gram, acidum salicylicum, 1.4, acidum benzoatis, 1.6, lanolinum, 40 gram, and basilinum, 40 gram. This prescription contains two bases. Yes, lanolinum and basilinum in the proportion 1:1, because 40 lanolinum and 40 basilinum. Please help me to prepare this second prescription. Step by step. At first step, what we must take? What do you think about this? Mushtaba, go and prepare this prescription, Mushtaba. Mustafa, you write in blackboard, Mustafa preparing. How we doing all time in our classes. Mushtaba. Hasin. Where are you, my dears? Really? Najla joining. Who can say how I can prepare this prescription? At first we take Hiba what? I show
Vaseline.
Vaseline and lanolin. Yes. We mix them. After we add our solid substances such as benzoatic acid and salicylic acid, and at last we add our spirituose, iodum spirituosum 5%. After mix them until preparing homogeneous cream. Yes, they are used as emollient creams from cracks in the feet of the elderly. This is a very good prescription, I want to say. Now our next prescription, solid dosage forms. You know that suppository is the solid dosage form too, and commonly using in geriatric practice. Do you know what is what disease? Hemorrhoids, hemorrhoidal disease, intestinal disease, hemorrhoids. This prescription, this recipe from hemorrhoids. Contain 0.11 novocainum, 0.13 gram anesthesianum, 0.1 gram xeraformium, how can I say about this amount? This is gram, centigram, milligram. What is this? My dears.
Centigram.
Only Hiba here and only Hiba listen me. Yes, my dears?
No teacher, listen.
Listen. Only listen. But I want you to help me. Please help me to prepare it, Tola.
Teacher, I don't know.
What is this? What is the base for this recipe, my dears? Ali, I want to hear you, Ali. Your requirement to me that I must start my lesson at 3 o'clock, not 11 o'clock. Now, please help me to prepare this prescription. Ali. Oh my God. Oleum cacao, the base for this recipe. At first we take oleum cacao, and after we add to this oleum cacao all other substances, mix them carefully, and after by hand we prepare our suppositories. We have special instruments for suppositories, if you remember my class. Hiba, if you remember, we store
Yes.
how we prepared suppository in our laboratory. Can you remind us
Yes.
how we prepared step by step? Step by step. What we do it? We mix all substances in our base and after add to cavity. If you remember, we have special instrumentos for suppository. We add to this instrumentos and after storage in our refrigerator for 3 or 4 days. For 10 minutes, but we have not so time for this. We store the 3 days. After we put from this instrument and of course it's ready for using. Our next prescription about suppositories which contain novocainum 0.1 gram, streptocidum 0.3 gram, xeroformium, collargolum, solutionis adrenalini hydrofluoride 0.1%, guttas. What means gutta? What means gutta? My dears, gutta in Latin. Gutta, Mohammed. Hiba, what means gutta? Najla. Drop, my dears, drop. Anesthesianum 0.05 gram, vaselinum and lanolinum. This is for hemorrhoids to people. We know that hemorrhoids proctological disease, and the disease is most susceptible to people aged 45 to 65. Our next prescription, anti-inflammatory collection or species, which contain Frutti crategi, Herbe millifolii, Gemmi pini, and Herbe artemisiae. We prepare it by the classic technology of species from herbs. Next prescription, liquid dosage form mixture, which contains infusia herbe leonuri, natri bromidi, coffeine natri benzoates, tincture mente piperite 2 gram, magnesia sulfates 0.8 gram, and analginum. I say incorrect 0.8 gram. How must I say this? 0.8 means 8 decigram. Okay, our next prescription. Drops which contain tincture convallaria, tincture valeriani, and adoniside, Anna 10 milli. we prepared it. We must prepare by classic technology of drops. Next, drops of Morozov. This is Russian scientist, which contain tincture valeriani, tincture convallaria, tincture crategi, dimedrole, and corvalole. Our next prescription, I want to show you the technological process of some commonly using recipes in geriatric practice, such as zinc oxidum, amylum, vaselinum, and how we must prepare. For calculation, we must know that this is suspension ointment, since zinc oxide and starch are not soluble in water. 1 minute, please. We have no so many time, but we must continue. Calculations. Mass of zinc oxide plus mass of starch, amylum, and divide to total mass and multiply to 100%. And so we calculate that suspension phase is 50% of all total mass. Okay, my dears, we continue. Zoom gave us only 45 minutes, but we must continue. Please reconnect and we must continue. We stopped in the passport recipe of zinc paste ointment, and we talked that we must write in passport recipe working recipe. In working recipe, we know that we must write zinc oxide 25 grams, starch 25 grams, vaseline 50 grams, and total mass 100 grams, and mass of containers. But in passport recipe, we add to it prepared by, checked by, and released by. And of course, labeling. In label, we write for external use ointment, and warning labels: keep in a cool place, keep away from children, and storage period 10 days. My dears, I won't step by step say you about technological process, how we prepare our ointment. Technology of this ointment that we take 50 gram vaseline, melted it in a porcelain cup in a water bath. Since the paste was written out, then according to the rules for making paste, the whole base is melted in a porcelain cup in a water bath. 25 grams zinc oxide is placed in a heated mortar and triturated according to the Geriatric rule. If you remember, by Geriatric rule, you must take only 50% of total mass. It's about 12.5 grams. Because 12.5 gram equal 15% of the mass of the solid phase, and of molten vaseline to obtain a thin pulp. In this case, the liquid provides a proper effect and creates a viscous pulp medium in which the friction force during grinding is maximum. Starch is an amorphous substance and does not need to be crushed. In addition, when mixed with hot petrolatum, gelatinization is possible. Therefore, 25 grams starch is added to the zinc oxide pulp, and then the cooled fused vaseline. It is stirred until cooling and transferred to a jar previously weighed on a scale. Cover with a lid of a parchment paper. Ingredients properties so that zinc oxide is an odorless, white or yellowish white powder, practically insoluble in water and alcohol. Starch is a white, delicate, odorless and tasteless powder, or pieces of irregular shape that when spilled easily turn into powder. Insoluble in cold water, alcohol, glycerin, it forms a paste in hot water. Storage in a dry place. Petroleum jelly or vaseline is a flavorless, odorless, oily mass, white or yellow in color. When smeared on a glass plate, it gives a smooth, non-slip film. Recipe ingredients are compatible. And now, my dears, I want to show you the making process of this ointment. Please, I want to show you. 1 minute, please. Now I want to show you the making process. At first, we illustrate the proper preparation of zinc oxide paste. We must show how to properly triturate powders and to exhibit proper leveling technique. Which excipients we use for preparation of this ointment? Starch, we talk about starch and its properties, zinc oxide powder, and petrolatum or vaseline. Equipments and apparatus. Which apparatus we use for this? Ointment slab. If you remember, we used them in our laboratory. Mortar and pestle, spatula. And now, making process. First step, trituration of the zinc oxide and starch. We take our mortar and pestle, add our zinc oxide powder to our mortar, after starch, we add to our zinc oxide powder in our mortar and triturate them or mix them. Second step, levigate the mixed powders with the vaseline or petrolatum. For this, we add this mass from our mortar to our slab and add to our powders petrolatum. And with two spatulas, we carefully dissolve our powders in our vaseline or petrolatum. If you see, my dears, we add petrolatum portion by portion for carefully dissolving and completely dissolve our powders in petrolatum. And so we continue until forming homogeneous ointment form. So our ointment is ready because our powders completely dissolved in our petrolatum. We work only by two spatulas. Now, third step, transfer the paste into an ointment jar. This is our jar. We must weigh our jar in scale before using, because we must write in our worker recipe and passport the weight of container too. And so pressure our ointment into our jar. So accurately we pressure our ointment into our jar, and first step, seal with a white paper. This is our last step. We seal with paper our jar, and fifth step, label properly. If you remember, in label we must write that this ointment for external using. So we close our jar, and if you see, in our jar there are written our label. In label, I want to remind you, we write the ingredients, their mass, and of course their using. Now our next prescription We continue, my dears. Our next prescription, mentholium and unguentum camphorate. For this, in our ingredients of our ointments, mentholium 4 decigram and unguentum camphorate 20 gram. For external using, rub into joints. This is the ointment solution, and in this prescription written ointment solution, since camphor, which is part of the camphor ointment, and menthol are soluble in the base. How we calculate? Our calculation include that camphor we must take 10 parts, which equal 2 gram, vaseline 60 parts, which equal 12 gram, anhydrous lanolin 30 parts, which equal 6 gram, and our total mass 100 part, which equal 20 gram. Total mass of our ointment is 20 gram. In working recipe, we write so: menthol we take 4 decigram, vaseline 12 gram, camphor 2 gram, because unguenti camphorati include vaseline and camphor. Anhydrous lanolinum 6 gram, and total mass 20.4 gram, and of course mass of containers. In passport recipe we write date and number of this prescription. We write all from our working recipe and add prepared by, checked by, and released by. About technology of this ointment and ingredients, what we can say about the technology: a portion of 12 gram petroleum jelly or vaseline, about 12 gram petroleum jelly or vaseline we take, and add to it 6 gram anhydrous lanolin, placed in a porcelain cup and melted in a water bath. Since taking into account the solubility of menthol in vaseline, this portion is 1:5, and camphor in vaseline, its portion is 1:7, and lanolin 1:8. Substances can be dissolved in the entire base and not in its part. In a semi-cooled base, since menthol and camphor are volatile substances at a temperature of no more than 40 degrees Celsius. 4 decigram menthol and 2 gram camphor are dissolved. It is stirred until cooling and transferred to a jar previously weighed on a scale. After we label, in label we write that this is for external using ointment, keep in a cool place, keep away from children, storage period is 10 days. About ingredient properties, what we can say about ingredient properties: menthol is colorless crystals with a strong smell of peppermint and a cooling taste. It is volatile at ordinary temperature and is distilled with water vapor. Very slightly soluble in water, portion 1 to 1800. Easily soluble in vaseline, a portion 1 to 5. Storage list B in a cool place. Vaseline is a flavorless, odorless, oily mass, white or yellow in color. When smeared on a glass plate, it gives a smooth, non-slip film. And camphor is white crystalline pieces or a colorless crystalline powder with a strong characteristic odor and a spicy bitter. Then cooling taste, with careful heating it disappears without carbonization. It is slightly soluble in water, portion 1 to 840, easily soluble in petroleum jelly or vaseline, and portion 1 to 7, and in lanolin 1 to 8. Storage in a cool place. And anhydrous lanolin is a thick viscose mass of brownish yellow color, a weak peculiar smell. It is practically insoluble in water. Storage in a cool, dark place. And I must say that recipe ingredients are compatible. Now I want to show you the making process. Please, I want to show you. Now, my dears, I want to show you the making process of menthol and
into a mortar, grinding up the pieces. This should create a paste-like consistency. Place the wax and the petroleum into the beaker and melt on hot. Once melted, add the camphor and menthol mix.
Now he add camphor and menthol mix.
Once cooled, use an ointment mill to grind up the particulate. And then use an electric motor.
This is electric motor, my dears, electric motor and pestle. Okay, our ointment is ready. So now we know how to prepare menthol and camphor ointment. My dears, it's enough information for our today lesson. I want to remind you the topic of our lesson was preparation of geriatric recipes, and we will continue next week. Thank you for your lessons, my dears. Until which time we have lessons?
22.
22?
Yes.
May?
Yes.
And what they say about your exams?
We don't know.
Okay. Okay, I end our congress. Thank you for your attention and see you, my dears. Okay?
See you, teacher. Thank you, teacher.
Thank you.